Kia ora koutou katoa. Hello, everybody. My name is Ali Seyfoddin, and we are here again with Dr. Shabnam Sarshar from Germany. It's our evening here in New Zealand and mid-morning in Germany at the moment. And we are back with another episode of the Conscious Science podcast. We have been discussing cannabis in the first few episodes. We've gone through a general introduction to cannabis, the endocannabinoid system, use of cannabis in mental health disorder. And today we are going to talk about the use of cannabis in the management of pain. And is a huge problem. It's part of a lot of different mental health and as well as physical diseases, disorders. And in many countries around the world, chronic pain treatment has been associated with a lot of side effects due to the drugs that have been the mainstream for management of these conditions, namely the opioids. So cannabis in recent years have been, people have focused on the use of cannabis for pain. And perhaps, if you look at the studies that are coming from America and Canada, you'll see that the majority of patients report that they use cannabis for the management of pain, sometimes as high as 90% of patients. So with that short introduction, I just want to also read this quote from Buddha today, Shabnam, that says, pain is inevitable, but suffering is optional. And
I love that quote.
Yeah, so I think it has a lot of deep meaning, but it is also applicable to what we are discussing today. Over to you, Shabnam.
Right. Okay. Yeah. Hello from my side. Salam. Ali, you mentioned some statistics about chronic pain. I just wanted to add some figures that we really understand how big this issue is. Actually, 1 in 10 person are diagnosed with chronic pain every day. And chronic pain is something so complicated. Even though there are lots of research on pain mechanism and stuff like that, people like the doctors, scientists really don't know what is the mechanism of chronic pain, what chronic pain even is. Like the definition of chronic pain is a severe pain that insists for more than 6 months. Okay, so you have if you have a back pain or neck pain or whatever, and you are suffering more than 6-7 months, then that pain becomes chronic, and that chronic pain can have different reason, and unfortunately, most of these reasons are it's some kind of a referral pain. So you have a pain in your hand, but actually that might be because of a stress, because of an accident that you had years ago, but the in memories is still there, so you still feel that pain. Or you had an emotional trauma, and that trauma basically manifests that in your body with kind of a vivid pain. Or inflammation can cause to chronic pain. Anyhow, the mechanism is just not 100% clear, but some of the sad statistics about chronic pain is that 85% of people with chronic pain have severe depressions. So now the question is that does severe depression cause chronic pain, or chronic pain cause severe depression, or they just basically hand in hand make a life of an individual more miserable? That was one thing. The other, you said about your patient I think it was pre-recorded. I don't know if you recorded or not, but you told me that you had a patient that he has suicidal thought. Actually, the rate of suicide in chronic pain patients between 2003 and 2014 raised from 7 to 11%, because our gold standard medication for pain is opioids, and I have to say, till now, there is no more effective analgesic than opioids discovered, but opioids cannot damp down or cannot treat all kind of pain. That's why like 50% of chronic pain patients are super dissatisfied with opioids, and they are like in search for alternative treatments. And as you mentioned, like cannabis got a very good reputation when it comes to chronic pain, because it's basically like tackle down the pain from with another mechanism, with another receptor. So like if you want, we can just shortly talk about like why cannabis work as an analgesic, what is the mechanism of action, and then we
Absolutely. I
can
think
like take the rest of.
sure.
Okay.
Just before that, Shabnam, you talked about chronic pain, and so maybe at this stage, let's just quickly go over all the different types of pains, because in some categories classifications they do it as mental pain, physical pains, and the physical pain is subdivided to different categories. And you said one of them is chronic pain that lasts for a few months, and then we've got acute pain that is the opposite of chronic pain, like it doesn't last as much. Yeah.
Exactly. Like for example, a typical example for chronic pain is fibromyalgia, or like basically back pain, severe back pain. And for acute pain, yeah, okay, you have a broken leg or you got a surgery or stuff like that. And then we have neuropathic pain, which is basically the cause is your neurons get damaged. If you have alcoholism, or you have a stroke, or you have limb amputation, so all of this like goes under the
A
category
burn.
of neuropathic pain. And then we have nociceptive pain. The banal example is that you put your hand on a fire and then it hurts, so that is nociceptive pain. It's basically the immediate response of the body to one stimuli. Cannabis gained a lot of reputation in addressing chronic pain, neuropathic pain, and kind of nociceptive pain because of the endocannabinoid system in our body. We already discussed the endocannabinoid system, that the receptors are ubiquitous in our brain, in our nervous system, on our skin, and basically cannabinoids can interact with these receptors. So that's why cannabis can be really helpful when it's come to chronic pain. But shall we go through the mechanism of like how endocannabinoid system modulate pain? Do you think it's something that we?
Absolutely.
Okay.
And because we've
Right.
got the two prominent cannabinoids, and each of them, as we recall, they bind to different receptors, CB1 and CB2, and so their role in the treatment of pain is different. And that's the beauty of cannabis again, because it's a multi-action drug. It's a disease modifying drug, so it's not possible to pin down the mechanism of action to a specific molecular interaction. The nature of the endocannabinoid system is such that it affects our nervous system as well as every other organ in our body. Yes, let's talk about the mechanism of action.
Okay, yeah. As you said, like I love what you said about like cannabis be multi-targeted, basically like medicine, because like we want to explain everything in a very simple sense, and then we always have, yeah, okay, you have pain, so your opioid receptors are involved. Take some opioids, and then you're gonna modulate your pain. Our body is it's much more complicated than that, and like our whole body is a huge equilibrium of feedback loops. it's never one receptor involved, never. And that's exactly what you said. I love that. The beauty of cannabis, because it is involved with different receptors, with different mechanism. And actually, I believe that is the future of pharmacy. That is the future of like treating any kind of disease, not just like focusing, like understand to see our body as a whole system, not like individual part. Like if I have like some heart pain, I go to the cardiovascular specialist and that's it. No, maybe your heart pain is like has psychological reason, you know. But yeah, I'm so positive. I'm so positive that the future of medicine and healthcare is like more personalized and more holistic, but just like
We
go
we
back to the
have to
mechanism of
we have to go back to our
pill.
history and integrate some of those ancient systems into our modern medicine. Like in this little country, that we are a very isolated civilization, but even then, the people of the land here, Maori, they have a system of medicine called Rongo Maori. So they use a lot of different herbs, but the first step is to treat the spirit. You know, so they do a whole lot of different spiritual practices, chanting, energy healing, connecting with the ancestors to relieve your spirit before they start treating your body. So I think
Yeah,
we had
yeah.
this, we had this, we lost it, and we're going to rediscover it again.
Absolutely, absolutely. I mean, again, I think like before we start this episode, we also talked about like the how emotional trauma, how basically diseases can cause pain, and that's exactly that, because you know, stress, anxiety, and so on can cause physical pain. It's kind of our body talking to us, yeah, okay, I cannot take it anymore, think about it. So yeah, we're gonna get back to this. So let's just continue with the mechanism of action, like how endocannabinoid system is involved in pain perception. As you said, like endocannabinoid system, we have a lot of like receptors throughout our body. We have endocannabinoids like 2-AG and anandamide and many more, like basically producing on demand on the neuron synapses. And when it comes to pain, and you have some kind of pain and inflammation in a part of your body, these endocannabinoids are produced on demand. And when they are produced in that like neural cleft, basically neuron cleft, it activates the endocannabinoid receptors, particularly CB1. Okay, and that's again, this activation start to cause another processes in our body to stop basically cytokine pro-inflammatory markers, stop like producing them, and it has an analgesic effect, different than what different receptors and opioid does. Another way of like analgesic, but it has anti-inflammatory effect, it has analgesic effect, and so on and so forth. Okay, so by that, our endocannabinoid system and endocannabinoids modulate the pain. Also, we now understood that like also on the skin we have endocannabinoid receptors, like vanilloid receptors are part of endocannabinoid system. And if you have like nociceptive pain, endocannabinoid system are also involved in reducing pain in case of nociceptives. And we know that the major cannabinoids from cannabis, CBD and THC, can activate those receptors. THC can activate like CB1 and CB2, which shows analgesic, like reducing pain and reducing inflammation. And CB2 does not interact or activate any of these two receptors, but kind of modulate. It works as a super transporter, basically, like help other endocannabinoids or THC even activate or have a better activity or function on these receptors. So the combination of them, like THC and CBD, turn out like there are many clinical studies, anecdotal reports, and so on and so forth, that how cannabis could help with chronic pain and nociceptive pain. Also, like lots of people who do professional sports, people who do a sport as a profession, they also use like these CBD muscle rubs to get the tension from their muscles. So it's not just for the chronic pain. Generally, these cannabinoids can help us like recover soon and reduce pain, especially for chronic pain. So yeah.
Yeah, just to add to that, just a couple of other points around the mechanism of action. What I found really interesting, Shabnam, is that CBD, although it doesn't, directly binds to to the endocannabinoid receptors, it influences the endocannabinoid receptor by inhibiting the breakdown of the endocannabinoids like anandamide. And anandamide plays a huge role in the analgesic action. The other amazing
Yes.
thing which makes this medicine a holistic medicine is that THC and CBD, they inhibit the release of a lot of neurotransmitters that are associated with stress and anxiety. So in another way, they're also treating the emotional aspect of pain, but also they activate the dopamine and serotonin systems as in our body as well, so that general feeling of well-being is boosted when you take cannabis in the treatment of pain.
100%. I mean, like actually, improvement in quality of life, it's almost always a secondary endpoint in clinical studies, and almost always more than 85% of the patients say, okay, the consumption of cannabis significantly improved their quality of life. I remember that was a very special case that, like, for one patient, cannabis really didn't help with the pain. It was an older man, I suppose, that he quoted, yeah, okay, I cannot tell that cannabis really decreased my pain intensity, but I can again enjoy eating dinner with my wife. So
Yeah,
for
yeah, that's
him was like,
yeah. I
that's
think
beautiful.
even in cancer patients, like the nausea is usually associated with the chemotherapy, but people who have chronic pain or severe pain, that is by itself is associated with nausea. So cannabis take care of that. When you have chronic pain, your appetite is also reduced. Cannabis can increase your appetite. When you have pain, you can't
Yes.
sleep. Cannabis can help with sleep as well. So this is a real good example of that multi-target effect, and perhaps it is why about 90% of patients report, the main indication for using cannabis is management of pain.
Yeah.
So no
Yeah.
surprises there.
And okay, maybe I shouldn't say that, but I will do anyhow. I think the rest of 10% that don't find cannabis helpful, I think they didn't find the right
No, 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 no,
application, you know?
no, no, no,
Otherwise,
no.
100%.
No. The data was 90% of patients reported that they use cannabis for chronic pain. The other 10% were using it for anxiety, depression, other
Yeah.
indications. Like
Okay.
like
No.
yeah.
Right.
Not in terms of efficacy, in terms of no, the percentage of patient using it for this indication.
Yeah, okay. Yeah, because it's also like you are a pharmacologist, so maybe we can just like talk a little bit about different cannabis, like chemovars application forms. I find
Oh
it
yes.
super interesting because, like, with this medicine, you have a variety of chemovars, variety of application forms, and it can be really personalized. So maybe Ali, you can like explain that for us.
Sure. Yeah, I think if you look around, there's a lot of different chemovars that are recommended for taking for pain, but mostly when you look at them, they're either indica or hybrid species. I think sativa could work for some patients, but but you really want to have a good concentration of CBD along with THC in the cannabis that you take. So if you're taking dry herb, there's a lot of different strains out there, hybrids, indica that you can use. Um, and um, and also, the terpenes are quite important. So things like myrcene, theophylline, these are all known to have their own analgesic effects as well. On the other hand, if due to your chronic pain your morals are a little bit low, or if you're stressed or depressed, chemovars that have limonene in it could be quite energizing for that kind of action. So that's for dry hair. But when it comes to other types of preparations, oral preparation, drops, tinctures, you've got a lot of different choices. If you can go for whole spectrum, definitely that's the way. If not, you're looking at for many conditions, I find a 1:1, 10 milligram to 10 milligram CBD THC a very effective way of treating the condition. So that's to do with the chemovars and types. And I don't know if you want to add something to that, Shabnam.
So actually, I wanted to say, okay, you know that we have like different kind of pains. We just talked about it,
Yeah.
and like how can we select the best application for pain? For example,
Okay.
for acute pain,
Yeah.
they say that inhalation is the best way. For chronic pain, edibles. Can you explain why that is in terms of like, yeah,
Yeah. So
pharmacology
that
and the
okay. So that is to do with the delivery method and basically the onset of action. How fast the cannabinoids are absorbed into your system. And I'll talk about the pharmacokinetics and onset of action, and maybe you can tell us the difference that happens in terms of the action from different routes of administration. Cannabis is mostly smoked, or a healthier option is to inhale the vapors, and that is getting absorbed through our pulmonary system, through our lungs. Now, if you look at the respiratory system, at the very last parts of the respiratory system, there are these structures called alveoli, and they're in direct contact with the blood. As we know, the lungs oxygenate our blood, and the carbon dioxide is exhaled as so direct entry into our blood system, very quick, similar to smoking. When you smoke nicotine, you can see the effect pretty quick, and it's the same way with cannabis. Inhalation gives you a very fast relief. You see the effects in a matter of a few minutes, if not instantly, and the effects usually last for about 1 or 2 hours and before they start to the cannabinoids get excreted from the body. So if you've got an acute pain, perhaps that's the way to go. For a lot of chronic conditions, I think oral therapy is best. When you take cannabis orally, although it gets metabolized in the liver, it is still quite effective. And the benefit here, for cancer patients, for people who have fibromyalgia, all these different types of chronic pains, you get a much longer duration of action. So depending on the person, it can be from 4 to 8 hours. There's a lot of person to person variability. However, the onset of action is quite slow. So that again changes from one person to another. Like my experience with edibles is that I absorb very quick, like in about 10-15 minutes. I know that I've got cannabinoids in my system. Other people, it may take hours before they see an effect, but it's usually a little
yeah.
bit of trial and error before they know, and they can time the doses to kind of sustain that release. And a lot of time patients combine the two methods, so they take an oral preparation, as well as having access to vaporizers for immediate relief. And finally, to add to that, there's also, cannabis can be applied locally. Thousands of years ago, cannabis balms and creams have been used in many traditional systems. And the cannabinoids, although they're quite large molecules, they're quite lipophilic, and they can get absorbed through the first few layers of the skin. And that's where the endocannabinoid system exists on the skin, so they can interact with that and not only have local effect but also induce systemic effects. So even for things like arthritis, I've seen that local application of cannabis oils or creams can definitely help with the skin conditions, with neuropathic pains. Cannabis can help in that way, but also through other local site of delivery. For example, I've seen in Europe and Canada there are products made for women. You can insert it in the vagina for period pain. You can have there's there is another way of delivering the endocannabinoids where you want them.
Yeah. I find like vaginal suppositories most interesting when it's come to women health, especially for conditions like endometriosis or like vulvodynia, dyspareunia, like painful sex, and because the effect is fast, it's like systematic. Still, you have like local and systematic effect, and it doesn't pass the first metabolism. So
Yeah,
you have
doesn't go
again
through liver.
everything like right. And I mean, for women, I believe that like vaginal suppositories is one of the most effective way of cannabis delivery, and like that you can also better I think you can better adjust the doses. So like by edibles, I find edibles super interesting for the people who have like chronic pain, like as you said, cancer patients, so they can take their drops or tincture or capsules at the night and then go to sleep, and then the drug, they have the drug effect throughout the night. But what is a little bit like dangerous with edibles, especially not for the medical use, especially for is that some people who are not very much experienced with that, they take one piece of like cookie or chocolate or cake, whatever. After half an hour, they think, oh, nothing happened, so I take another piece. And like after, and that can cause disastrous outcome, because suddenly it's like a bomb and you don't know what to do with it. You get super overwhelmed. So you have to be I think like edibles are even like in terms of like unwanted adverse effect or side effects, whatever. I think edibles can be harder than like inhalation, because by inhalation you understand, okay, I'm like the dose is not a right dose immediately, but for
Yeah.
edibles it's a little bit harder to find that sweeter spot.
Absolutely, and edibles, are more psychoactive because of that first pass metabolism. So THC is converted to hydroxy tetrahydrocannabinol, which is 4 times more psychoactive, and they stay in our body for much longer. So you're down for a roller coaster, at least
Yes,
for a few hours. And yeah, a lot of people get put off by that first experience. So yeah, as we've said before and always, especially when you're talking about medicinal cannabis, aim is not to get us high. So you can start with very low doses and build up your tolerance to THC slowly. Just give your body time to adjust, and give yourself time to experience the effects of the cannabis without jumping into that roller coaster. I think another important thing that is related to this is the tolerance that our body produces to THC. Because when it comes to chronic pain, an area where patients have to be careful to kind of manage the tolerance to THC. In general, it's not a bad thing to develop tolerance to THC, because side effects like dizziness or impairment in physical movements. You kind of build tolerance to that very quickly, and so you can function normally. But at the same time, THC has a lot of role to play in the management of chronic pain, especially with regards to activation of the dopamine and serotonin system. And so it is beneficial to keep an eye on that. If you've got access to all these different formulas, go for higher CBD formulas. Every couple of months, have 2 weeks where you reduce your THC dose, but you increase your CBD dose, and you give your endocannabinoid system a chance to kind of recover and reset, so that you don't keep developing tolerance to THC. Because if you do that, then most likely you will need to increase your dose of cannabis continuously to experience the same effects.
Yeah, okay. No, I'm super happy that you mentioned that, because sometimes in cannabis community, when you talk about that, because like it's obvious that you build up resistance. It doesn't matter if you also add 1 spoon of sugar in your tea every morning, then after 3 weeks you don't find it sweet anymore. You need to add 2 spoons. So the thing is that's exactly with THC, but sometimes in cannabis community is that, oh no, you don't build tolerance to THC. Yeah, of course you do, and
It's
that was super important that you
it's
said
it's
that.
it's not a simple equation. So, unlike many other drugs, we do develop
Right.
tolerance to the side effect of the cannabis. So if you're talking about medicinal cannabis, the psychedelic
Right.
effects or the motor impairment effects, those are the side effects. So we do develop
Yeah. Okay.
tolerance to that, and that's good. Now, for a lot of different conditions like anxiety, nausea, appetite, sleep, that doesn't matter. So after, if we actually recommend patient, okay, keep increasing the dose until you see a therapeutic effect and outcome, and just then we maintain that dose. Okay, so no problem. Tolerance to THC, and they don't even notice they're taking any cannabis medicine. But with regards to pain, because of all these other things that THC does with the serotonin system and dopamine system, we want to keep, we don't want to develop tolerance to it. Like,
Okay.
so they're kind
Yes.
of right and wrong. In most cases, we don't develop tolerance to the medicinal effects, just the psychoactive
Okay.
effects of the THC.
Okay.
Um, but in this case, it's good to keep it under control.
Yeah, right, right. Okay, great.
Mhm.
Ali, I actually wanted to, because we talked about the like mechanism of action of endocannabinoid system in pain, and I remember that I forget something to add,
Mm.
because we know that when it comes to like pain, chronic pain, or whatever, placebo effect is a powerful, like superpower of our body to sometimes control and maintain pain. And I just wanted to add that endocannabinoid system. Now scientists discovered that endocannabinoid system play a very important role when it comes to placebo effect in our body, because you mentioned that anandamide and 2-HE, all of these are basically our internal analgesic that our body produce on demand, and they get active when body is under inflammation or like injured, also in the case of like chronic pain. And the other thing that endocannabinoid system is involved in is the neuroplasticity. And when we talk about neuropathic pain, or when we talk about this pain memory in our body, like again, you had a car accident 2 years ago, but still your hand, you feel pain in your hand, or you amputated your hand, but still you have think you have like pain. So this pain memory basically is what sometimes make life of chronic pain patients miserable. And neuroplasticity and endocannabinoid system, with the help of cannabinoids, can really be another mechanism to tackle chronic pain, because with increasing the neuroplasticity, we allow the neurons to find a new pathway in our brain, so we can build up new pain relieving memory, and that helps. So that was the part that I just wanted to add to our conversation. And again, at the beginning of our talk, we talked about the book The Body Keep the Score from Van der Klook. But we also have to understand the body keep the score. When we go through a trauma or through very bad psychological condition, we can definitely develop inflammation, chronic pain, like in fibromyalgia cases, which 80% are women, and 80% of the fibromyalgia patients are women, and the majority of them had either sexual trauma, childhood trauma, or whatever. So it's definitely related to some kind of emotional, painful memory, which basically manifested itself now in physical pain. And the pain is the construct of our brain. Our brain set the score for the pain. And that's why, again, the psychoactive effects of cannabis and psychoactive effect of different psychedelics can be a new treatment methodology for chronic pain. So that was basically the part that I thought it's super interesting to mention, because if there are young scientists out there that they wanted to try some new or unconventional method to help the patients, please search. It's a growing body of evidence, the effect of basically neuroplasticity and the default network mode in the whole pain. It's amazing, it's like a wonderland for itself.
Absolutely, absolutely. I'm hoping that once we've got a dozen of episodes under our belt with regards to cannabis, we can then start talking about other psychedelics as well, because the potential is huge. I mean, all these master plants have a lot to offer, and although we've been using them throughout our history, we still have got a lot to learn. And
Yeah.
yeah, it's good to see more and more people benefiting from these drugs, because a lot of people who go to these treatments in many parts of the world are people who have really given up on the choices that they currently have. They've tried everything, and for many people, it's a life-changing situation. And a lot of people go to these retreats, the psychedelic experience, and if you ask them, it's one of the most profound experiences in their life. So yeah, then when we get time, we're definitely gonna talk about psilocybin. We're gonna talk about DMT, ayahuasca, LSD, and everything else. So stay tuned. I guess we've covered information on pain and cannabis, and the only other thing that I think we did mention, but I just wanted to emphasize again here with regards to the mechanism of action, is that the anti-inflammatory effects of THC, and in particular CBD, is another very important contributor to management of and actually treating the cause of the pain. So keep that also in mind. I think I've said everything I wanted to say here, Shabnam. Is there any other points you want to discuss?
No, actually not. I just wanted to say, if you're interested in basically clinical studies on cannabis and chronic pain, there is a lot. I think the chronic pain and cannabis is the most published clinical studies are around this topic. So yeah, if you want to know exactly what is the mechanism of action or what happens or what was the efficacy rate and so on and so forth, have a look. Like there are a lot of reviews, and I think the recent publication that I found, the recent publication that I found was for Drug Science, which was a publication in 23, like 55 chronic pain patients with the background of PTSD, anxiety, and PTSD, anxiety, and MS. And again, like no surprise, the use of cannabis, like medicinal cannabis, after 3 months, subsequently reduced their pain and improved their quality of life. And they could also like reduce the morphine or another opioid consumption up to like 85 or 90%. So that was like, yeah, that just one of the thousands of published studies around cannabis and chronic pain. Other than that, yeah, I think we covered almost like all the points that we wanted to cover. But again, that would be amazing if we get some questions so we can again fine tune a little bit the topics that we are talking about. That would be amazing.
Absolutely. And look, if you're suffering from pain, any type of pain, I think there's also a lot of, as Shabnam says, a lot of scientific material to go through. But there's also a lot of anecdotal evidence and story from patients, if you look up in the internet. Because I work with cannabis and I do collaborate, herbal apothecaries and herbalists, I come across a lot of patients that with a lot of different conditions. So I think we're going to talk about female related problems with Shabnam extensively in the next few episodes. So if you suffer from period pain, from fibromyalgia, painful intercourse, you don't even have to smoke cannabis. Topical application can help you. If you've got any other types of chronic pain, just look at the stories around the web. If you've got a cancer, the chemotherapy can put forward a lot of pain and discomfort. I had a student who was doing a master's with me a few years ago, and one day I got a call from the student to know that the mother was diagnosed with cancer, and she was in a lot of pain, and so we referred her to a clinic, and then she was given medicinal cannabis. A few months later, I received a message from my student to say that their mother had passed away, but they were very grateful for cannabis, because although the pain didn't completely go away, the suffering went away, and they were able to eat well and just a much higher quality of life before transitioning into death. So yeah, there's a lot of different personal stories that people have affected, positively been affected by cannabis, and even in terms of opioids, there are a lot of studies that show that small concentration doses of cannabis along with a small concentration of doses of opioids is as effective as the normal doses that are administered. So, yeah, the body of knowledge is ever increasing in this area. So, don't let your body and your spirit suffer because of pain. Search. And if you see cannabis can be helpful, talk to your GP or go to a cannabis clinic and get that prescription ready. Shabnam, thank you so much
That was
for
such a
being
nice
here
flow.
again. We had a bit of break between the last episode and this episode. I went to my sabbatical trips to Australia and Thailand. In future episodes, I'll tell you some stories around the cannabis
Oh,
industry in
nice.
those countries as well. But for now,
Maybe you can also share some photos.
yeah, absolutely. But yeah, lots of gratitude. Thank you very much, Shabnam. Thank you so much to our
Thank you,
listeners,
Aina.
and we look forward to seeing you and having you here soon.
Have a super nice rest of the day whenever in day you are, and hope to see you in the next episode.